How to use the DermaLab Aesthetic. DermaLab Aesthetic Skin Analysis is used in aesthetic clinics to assess the skin before recommending treatments. For the most accurate results, we recommend that the client arrives without makeup on the skin. However, makeup around the eyes and lips is perfectly fine. Clients should arrive at least 15 minutes early to allow time to relax in a well-climatized room. This helps ensure that external factors, such as weather conditions or an elevated heart rate, do not affect the skin's condition. The skin analysis itself takes only a few minutes, but you may choose to take additional time for a deeper conversation about the client's skin concerns and needs. It is a good idea for the client to lie down during the analysis. From the client menu, you can choose to register a new client or to find an existing client. In this case, we will register a new client. Fill in all the needed information. When a client has been registered, press Continue to begin the analysis. In the main menu, you choose the parameter you want to begin with. Measurement of collagen level. Use the ultrasound probe to measure the client's collagen level. Choose the collagen parameter on the main menu. Apply a thin layer of gel to the skin, or just use a bit of water, as this is often easier to work with and helps avoid measurement errors caused by too much gel. Perform 2 reference measurements on the inside of the client's arm to establish a baseline collagen level, as this area typically has minimal sun exposure, representing optimal collagen levels. Initiate measurements by pressing the button on the probe. Next, take 2 actual measurements on the client's temple to determine the current collagen level. For each measurement, an ultrasound image visualizes the collagen level. The ultrasound image with a check mark is displayed on the results page and in the client's printout. You can choose to switch to the other image if desired. The measurement will be displayed on the main menu. The collagen measurement provides 2 results: the reference measurement from the inside of the client's arm indicating the individual client's optimal collagen level, and the actual measurement from the client's temple, indicating the client's current collagen level. This illustrates whether there is potential for a treatment to increase the client's collagen level. The closer these 2 results are to each other, the better. The ultrasound image visualizes the current collagen level. If the measurement falls outside the normal range, an orange triangle will appear. Measurement of skin moisture. Use the hydration probe to measure the skin's moisture level. Choose the moisture parameter on the main menu. A moisture measurement consists of 3 measurements performed on the T-zone of the client and 3 measurements performed on the U-zone of the client. Position the probe on the skin, exerting gentle pressure until a reading appears on the screen. Begin by measuring the T-zone followed by the U-zone. An average of each zone will be calculated. The 2 calculated averages will be displayed on the main menu when measurements are done. For the hydration parameter, a predefined normal range is displayed, along with the 2 measured averages. The higher the moisture value is, the more hydrated is the skin. Measurement of skin elasticity. Use the elasticity probe to measure the skin's ability to bounce back when it is stretched. Choose the elasticity parameter on the main menu. The measurement should be performed on the client's temple. Mount the adhesive ring on the probe face, then pull off the adhesive cover. Clean the skin and make sure it is dry, before placing the probe firmly on the skin. When the elasticity measurement is in progress, make sure to hold the probe cable to prevent it from pulling the probe and affecting the result. Perform the measurement by pressing Measure. The average result will be displayed on the main menu. The elasticity measurement evaluates the skin's retraction time, how quickly it bounces back after being stretched. A lower value indicates a faster retraction time, signifying higher skin elasticity. Measurement of pH level. Use the pH probe to measure the pH level of the skin. Choose the pH parameter on the main menu. Take the pH probe out of the storage chamber and wet the probe in a cup of demineralized water. Wipe of the probe to remove any excess water. Be sure to dry only the black enclosure and avoid drying the transparent glass. Apply the probe to the skin and press Measure. The result will be written in a light gray color on the screen until the measurement has stabilized. Upon completion, the color changes to black. Remember to insert the probe back into the storage chamber and in its probe stand with the tip fully covered by the storage buffer solution. For the pH parameter, a predefined normal range is displayed. Measurement of skin oiliness. Choose the skin oiliness parameter on the main menu. Skin oil measurement is conducted by collecting sebum with a sebum strip, which is then inserted into the integrated sebum reader module in the main unit. Insert a new sebum strip into the reader with the absorbing film text side facing down. The device will perform a zero calibration before telling you to proceed to the next step. Next, place the sebum strip on the skin in the T-zone. Press firmly for 5 to 10 seconds, ensuring the entire sensitive area makes contact with the skin. Finally, reinsert the exposed end of the strip into the reader and wait for the measurement to automatically appear on the screen. The measurement result will be displayed on the main menu as a sebum score from 0 to 100, with 100 indicating very oily skin. Again, a normal range is displayed, and if the measurement is outside the normal range, an orange triangle is shown. When all measurements are completed, the practitioner can generate a result printout for the client. Before the printout is generated, it is possible to add recommended treatments, making it easier for the client to remember the practitioner's suggestions. The system allows the practitioner to easily select and list the clinic's treatment options on the client's printout as recommended treatments based on the analysis. It's also possible to add a personalized comment. The result page can either be printed or saved as a PDF and sent to the client electronically. This printout helps the clients remember both their results and the treatments recommended by the practitioner, making it easier for them to make an informed decision and return for their desired treatment. Use the results of the analysis to recommend treatments and products to repair, optimize, or maintain the skin. Be sure to invite the client back for a follow-up analysis to boost customer satisfaction and loyalty, and thereby the overall success of your clinic.